Retropharyngeal abscess. First, the anatomy of retropharyngeal space. It extends from the base of skull to the bifurcation of trachea in the mediastinum at the level of 6th thoracic vertebra. The boundaries are anteriorly buccopharyngeal fascia and pharyngobasilar fascia, posteriorly prevertebral fascia, and laterally the carotid sheath. It is divided into two halves, the spaces of Gillette, by a fibrous raphe. The retropharyngeal space communicates with the parapharyngeal space. Contents are retropharyngeal lymph nodes. It's the nodes of Rouvier in children, which drains the adenoids, paranasal sinuses, and nasopharynx. It atrophies by age. Acute retropharyngeal abscess. It is the collection of pus in the retropharyngeal space. Etiology, most common in children due to suppression of retropharyngeal lymph node following upper respiratory infection, adenoiditis, etc. Perforation of the pharynx by a foreign body or pharyngitis can also cause acute retropharyngeal abscess. Another cause is acute mastoiditis. Clinical features are fever, dysphagia, odynophagia, stridor due to compression of air passages. In children, drooling of saliva, irritability, and torticollis are also seen. On examination, there will be a bulge in the posterior pharyngeal wall, usually on one side. Complications are rupture of abscess and aspiration of pus resulting in aspiration pneumonia, extension of infection to the parapharyngeal space, mediastinum, and septicemia. Investigations, the blood examination shows neutrophilia, X-ray soft tissue neck lateral view shows widening of the retropharyngeal space with air shadows and straightening of cervical lordosis. CT scan neck shows hypointense shadows. CT scan neck with contrast is used to distinguish abscess from cellulitis. MRI neck is also useful. The treatment, secure the airway if there is compression of the airway by large abscess. In such case, tracheostomy is done. High dose of IV antibiotics for 10 to 14 days, IV fluids and other supportive measures, incision and drainage of the abscess via intraoral route at the most bulging area in the posterior pharyngeal wall after needle aspiration. And the pus should be sent for culture and sensitivity. If the infection extends below the hyoid bone, external approach is preferred. Chronic retropharyngeal abscess, it is more common in adults. It is secondary to tuberculosis of cervical spine or tuberculosis of deep cervical nodes. The symptoms are mild and X-ray cervical spine shows caries. The treatment includes medical treatment, that is full course of anti-tubercular treatment. Surgical treatment is by incision and drainage. External incision at the anterior border of sternocleidomastoid muscle is used for small abscess, and external incision at the posterior border of sternocleidomastoid muscle is used for large abscess. Thank you.